Infection prevention and control is required to prevent the transmission of communicable diseases. Infection prevention and control requires a basic understanding of the epidemiology of diseases, risk factors. Hepatitis is an inflammation of the liver that is caused by a viral infection resulting in the injury, inflammation, or destruction of liver cells and interfering with the liver's ability to function properly. Severe viral infection can cause liver failure, which is often fatal. A number of known viruses cause hepatitis. Many hepatitis viruses are extremely infectious. The odds of becoming infected with one of these viruses is much higher than the chances of becoming infected with HIV. Hepatitis can live in dried blood on surfaces for 7 days and be infectious the entire time. Tuberculosis is a highly infectious disease that most often affects the lungs but can occur in almost any part of the body. Although at one time tuberculosis was nearly eliminated, the numbers of infected people have reached alarming proportions in recent years. More than 1/3 of the world's population now have this bacterium in their bodies. The most common way tuberculosis is spread in the United States is inhalation of infected droplet nuclei from someone coughing or sneezing into the air. Most people who carry the bacteria that cause tuberculosis never develop the disease and are asymptomatic. In this primary phase, they are not contagious. The only indicator that they are carriers is that they commonly have a positive reaction to a skin test called the Mantoux test. Tuberculosis can live in the air for 20 minutes and some surfaces for up to 6 months. Staphylococcus aureus is a bacterium commonly found on the skin and/or in the noses of healthy people. Although usually harmless at these sites, staph may occasionally get into the body and cause infections through non-intact skin, such as abrasions, cuts, or surgical incisions. These infections may be mild, such as pimples or boils, or serious, such as infection of the bloodstream, bones, or joints. Unfortunately, most strains of staph are now resistant to penicillin. Antibiotics such as methicillin can still be used to treat many infections caused by beta-lactamase-producing strains of staph. However, certain strains of staph have now also become resistant to treatment with methicillin, thus resulting in methicillin-resistant Staphylococcus aureus, or MRSA. Staph can live on surfaces for 2 to 6 months. These diseases are only a few of the many pathogens we as estheticians may at some point come into contact with. Proper infection control practices and decontamination can break the chain of infection and help to prevent the spread of diseases and potentially infectious materials. The chain of infection includes 6 links. In order for an infection to occur, all 6 links must be present. The chain of infection is as follows. An infectious agent is a microorganism such as bacteria, viruses, fungi, or parasites with the ability to spread infection. The reservoir is the normal living environment where an infectious agent can survive. A reservoir can be eliminated by following proper decontamination techniques. A portal of exit is a way for the infectious agent to get out of the reservoir, such as acne lesions, hangnails, non-intact skin, mucous membranes, or other potentially infectious material. Hand washing, covering wounds, safe handling of sharps, and disposing of waste properly reduce the likelihood of transmission. The mode of transmission is the method by which an infectious agent moves from the reservoir to a new living environment. Ways this is possible is direct contact, which is person-to-person contact, indirect contact, which is person-to-object contact, airborne transmission, or vector transmission, which is contact with an animal, insect, or parasite that injects salivary fluid by biting the host, deposits feces or eggs in a break in the skin. The portal of entry is a way for the infectious agent to get into the new living environment. Any break in the skin is an open invitation for pathogens. Acne lesions, hangnails, unhealed tattoos or body piercing, non-intact skin, or mucous membranes. The susceptible host is the infectious agent's new living environment. Anyone can be susceptible, but a person with a compromised immune system has a higher risk of infection. Factors to make someone susceptible include age, gender, ethnicity, disease history, nutritional status, and immune system health. You can break the chain of infection with work practice controls, engineering controls, aseptic procedures, and personal protective equipment, or PPE. There are 5 keys to asepsis. Know what's clean. The foundation of aseptic technique is cleanliness. Any item that has been thoroughly washed and then disinfected is considered clean and decontaminated. Know what's contaminated. Any item used on a client or any item that cannot be determined to be clean and disinfected is considered contaminated. Items are either contaminated or not contaminated. There is no in between. All contaminated waste must be disposed of properly in accordance with your state law. Know what is sterile. Sterility is the absence of all microorganisms. Tools and instruments used throughout procedures, such as lancets, Komodo extractors, tweezers, microdermabrasion tips, microcurrent tips, galvanic rollers, and wands, must be made sterile beforehand. Proper storage, handling, and opening of sterile equipment are essential. If the package is torn or has gotten wet, the item inside is not sterile. Keep clean, contaminated, and sterile items separated. Dirty or contaminated, clean, and sterile items must be kept completely separate from one another. Once a sterile item comes into contact with a non-sterile item, it is considered dirty again. Sterile items should never be stored near sinks or in any location where they may become wet or soiled. Moisture allows for passage of microorganisms through the packaging, resulting in contamination. Resolve contamination immediately. If at any time clean technique is broken or cross-contamination occurs, the situation must be resolved immediately. Cross-contamination occurs when pathogens transfer from one client or surface to another. If cross-contamination occurs, you must retrace all steps and decontaminate all surfaces, instruments, doorknobs, light switches, and so forth to ensure that the work area is clean again. Decontamination methods include cleaning, disinfecting, and sterilization. Cleaning is the first step to decontamination of any item or surface. Cleaning removes all visible dirt and debris and can reduce or remove a vast number of disease-causing germs. To clean an item, you must first mechanically scrub with liquid soap or detergent and warm water. Use a small brush to scrub hinged implements or under fingernails. Then dry with a clean towel. It is necessary to clean implements, surfaces, and equipment before proceeding with any further method of decontamination, as it removes invisible debris that can interfere with the efficacy of a disinfectant or sterilization. Disinfection involves using a solution that eliminates most microorganisms on hard, non-porous, non-living surfaces. It destroys all bacteria, fungi, and viruses, but not effective against bacterial spores. It's available in spray, immersions, or wipes. To disinfect an item, you must first clean and dry the item. Disinfectants are inactivated in the presence of residue, including oils, lotions, hair, skin, nail dust, etc. Wear gloves and safety glasses. Disinfectants are pesticides and can cause serious damage to eyes or if absorbed through the skin. It can cause skin irritation and allergic reactions. For implements, completely immerse in a disinfectant solution for 10 minutes or the time specified as per the manufacturer. Using gloves, remove from the solution with tongs. Prolonged immersion can cause dulling or damage to implements. Rinse if required and dry and store in a clean covered container or a closed drawer. For surfaces, spray with disinfectant solution and allow to remain wet for 10 minutes or the time specified as per the manufacturer. Wipe to dry. When looking for a disinfectant, it needs to be EPA approved and include an EPA registration number on the label. It should also specify which organisms the solution is effective in killing. Contact time, which is the time it should remain wet and in contact with the surface to kill said organisms. A hospital-grade solution is effective against killing HIV, hepatitis, and tuberculosis. It's only necessary if implements contact blood, body fluids, or other unhealthy conditions. Be aware of the dilution instructions as per the manufacturer. If it's diluted improperly, it renders the product dangerous and/or ineffective. Always make sure to add the disinfectant to water to prevent foaming. How often immersion solution needs to be changed is important. If it's not changed properly, it will become ineffective and may promote the growth of microbes. Always keep an MSDS on hand. Quaternary ammonium compounds, or QUATs, are potent disinfectant chemicals commonly found in disinfectant wipes, sprays, and other household cleaners that are designed to kill germs. They're certified by the EPA as pesticides and very effective at killing many kinds of microbes when used properly. It usually disinfects implements and surfaces in 10 minutes. Multiple quats are the most advanced form. They contain sophisticated blends of quats that work together to dramatically increase the effectiveness of these disinfectants. Phenolic disinfectants are powerful tuberculocidal disinfectants. They are a form of formaldehyde with a very high pH. It can damage the skin or eyes and is harmful for the environment if put down the drain. It can damage plastic and rubber and cause metal to rust. It is a known carcinogen. Bleach, or 5.25% sodium hypochlorite, is an effective disinfectant. To be diluted in a 10% solution, it can damage or corrode some metals and plastics if not used as per the manufacturer's guidelines. It can cause skin irritation or eye damage and irritation to lungs if the fumes are inhaled. It must be stored away from light and heat, and the solution must be replaced every 24 hours or after it has become contaminated. Sterilization completely destroys all disease-causing pathogens and microbial life, including the spores. An autoclave uses pressurized steam that penetrates the spore coats of the spore-forming bacteria. Exposing implements to steam is not an effective sterilization method. Dry heat sterilization is not recommended. The CDC requires that autoclaves be tested weekly to ensure that they are properly sterilizing tools and implements. A spore test is an acceptable method. Keep a logbook of all usage, testing, and maintenance for state board inspections.